My name is Shelley Olison, and I'm the National Sales Director for Dermatology and Plastic Surgery with Modernizing Medicine. I want to thank you all for joining us tonight. We'll start tonight's presentation with an overview of Dr. Swank's experience with EMA plastic surgery, and we'll follow with a Q&A session. Please feel free to write in your questions at any time during the webinar in the questions section of GoToWebinar's control panel. We will do our best to answer all questions, but if for some reason we can't get to all of them, we will follow up with answers after the broadcast. It's my pleasure now to introduce Dr. Gregory Swank.
Hi, Shelley. Thanks for having me tonight.
You're very welcome. Thank you so much for making time.
Oh, sure.
So, we'd love for you just to kind of start with perhaps, what prompted your search for EMR, et cetera. So if you want to perhaps go into some of that, Dr. Swank?
Well, what started us looking at EMR is the fact that all medical practices are converting to EMR, and we really didn't want to take any kind of hit with government incentives, and we wanted to take advantage of the incentive programs that they have available, and we wanted to take advantage of the meaningful use incentives. So we started looking at EMR systems probably about 4 years ago, and when we came across EMA with Modernizing Medicine, we were really attracted to it.
Great. And Emily, do you want to perhaps advance the slide to the next slide? Perfect, great. So if you would let us know a little bit more about your previous experience, if any, what you were really using before you moved on to EMA.
Before we moved on to EMA, we were using strictly paper charts and dictating, as I guess we've done over the past 20 years. So this was our first venture with any type of electronic medical record form.
Okay, perfect. And did you just look at EMA, or what are all of the systems that you vetted, and how long did you search for something?
Well, we use NextTech as our practice management system, so the first EHR system that we looked at was NextTech, and we were really very disappointed at the time, both with the system itself, and we had live demos. We have a very large practice. We got about 20 physicians together. NextTech came out and did an extensive demo, and it just didn't work. So that really turned us off. We were hoping that we would integrate that with our practice management system. And then we came across EMA with Modernizing Medicine. We felt that they had a really nice platform both for dermatology and plastic surgeons, and as we explored it further, it just seemed to work. Everything came together very nicely. It was useful for both the dermatologists and the plastic surgeons, and really we looked at only one other system. I think that was Patient Now, which we didn't like at all either.
Okay, great. Well, we're certainly glad that you selected us. I remember working with you in the sales process back when I was managing a territory myself, and it was just incredibly exciting for me because I believe that you are the largest dermatology and plastic surgery practice in North Carolina, correct?
That's for sure.
Yeah. So, and you certainly have a lovely operation. So I was so delighted when you started exploring it. And then when you decided to move forward with a pilot, we were all kind of holding our breath and praying that it would all work out. And so, we'd love to hear a little bit more about the pilot format that you chose to move forward with and how you ultimately implemented EMA across your entire practice.
Well, we started off, there are several of us who are fairly tech savvy in the practice, and what we did was decided that we would give EMA a shot with about 4 of the providers, 2 dermatologists and 2 plastic surgeons. And when we started out with EMA, I guess it was about 3 years ago now, it just works seamlessly, and as the other providers saw how well the few who started were doing with it, everybody else just jumped on board right away.
Okay, great. So tell me a little bit about how, after the pilot or even as you were phasing it in, what type of training you did, and well, let's just start with that. What type of training did you choose to do there?
We did the I guess it's a webinar type of training where we did all our training online. It was, a bunch of sessions, probably um, 10 different modules if I remember correctly, but the training was very simple and straightforward. The trainers at Modernizing Medicine were really fantastic. They very responsive to our questions, and to be perfectly honest with you, Emma is so intuitive. Uh, everybody catches on almost immediately. So it's the little nuances that you had to learn in the system itself, and once you learn that, you just sailed from there.
Okay, excellent. And did you not only did you phase it in with your providers, right? But did you
Right.
also phase it in how you saw patients, or did you go 100% from paper and dictation into documenting in Emma?
No, the four providers who started off would, do a handful of patients in the morning and a handful of patients in the afternoon on the electronic record. And again, it transitions so quickly, a lot quicker than I ever would have imagined it would. I was fully electronic probably by the end of 2 months.
Oh, wow.
Yeah.
That's pretty impressive. And I think, you haven't shared much about your practice, and meaning, the types of patients that you see, the volume of patients that you work through the clinic each day, so or the OR. So I'd love to know a little bit more about that as we're thinking about you phasing it in over a 2-month period.
Sure. Well, like you mentioned earlier, we have a very large practice. We have 8 plastic surgeons, 16 dermatologists, including Mohs surgeons, and we have a few physician assistants also. We have 7 different locations throughout North Carolina. Um, we do Probably my practice is about 60% dermatology related stuff, evaluating skin lesions, removing skin cancers, that sort of thing, Mohs repairs, and the remaining 40% of my practice is cosmetic surgery. Of course, the various providers differ. Of course, the dermatologists do only dermatology, including cosmetic dermatology, injectables, fillers, chemical peels, that sort of thing. And the Mohs surgeons, typically concentrate on Mohs surgery.
Right. Okay, great. And so, in general, how many patients do you see, and how many nurses or medical assistants do you work with?
Personally, I see maybe about 40 patients per day. Some of our dermatologists can see up to 80 patients per day.
Wow.
And each of us work with a minimum of 3 medical assistants. I have 3. One of our really busy dermatologists works with 4.
Oh, wow. Okay.
Yeah.
That's great. And I know when we were speaking before this, in preparation, you were saying that there's been a pretty big shift from you dictating everything after the visit, or really whenever you have time to catch up, to your staff doing a lot more of the documentation for you. So I think we'd love to know more about how those MAs assist you.
Yeah, I hate it to dictate, and oftentimes you're so busy in clinic, you do most of your dictations at the end of the day, and oftentimes you'll forget some of the details of the examination or the patient history itself by the time you get to the dictation room. With Emma, all of our documentation is done immediately in the examination room with a scribe. The medical assistants each have their own iPad, and I'll simply state a finding. They click on the iPad on the location of the body. Let's say I'm evaluating a basal cell, patient for a basal cell skin cancer. I'll just say raised pearly lesion on the left central cheek. They click the button and it's done. Um, Once they complete the note in the exam room, I walk back to my desk, and review it on the desktop form of the EHR. Make sure there's no mistakes. I click finalize and it's done.
Great, wonderful. Tell me a little bit about how they help with your cosmetic patients as well.
Well, same thing. If it's a cosmetic evaluation, whether it's for a breast augmentation, reduction, facelift, tummy tuck, all the findings, the plans are very well laid out in Emma. So they'll pull up, for example, for a facelift consultation, they'll pull up the impression aesthetic deformity face. They'll click on any problems, whether the patient has jowls, marionette lines, platysmal banding, loose skin. It's all clicked. The counseling is done right then and there, and all the they're all click boxes, and it's documented very well. As far as cosmetic surgical procedures, that's also documented in the operating room. If I'm doing a breast augmentation, my nurse will complete the entire operative note in the operating room before I've even completed the procedure, or before the dressings are on. And the same thing, I'll go back to my office as soon as I'm done. I'll review the note, make sure there's no mistakes, click finalize, and the operative note's done.
Wow, that's great to hear. I was also really excited to hear that you have, I don't know if it's your circulator or who does this, but that they track anesthesia levels, and they also use Emma to document in the recovery room. Is that right?
Yeah, I don't know if I would say anesthesia levels, but there are intraoperative notes for the nurses to document things such as sponge counts, needle counts, medications that are administered, fluids that are administered, that sort of thing. So all that's done in the operating room also. And then there's a recovery room note documentation where the medications that are given, vital signs, urine output, drain output, all that's done in the recovery room. So it really gives you a very detailed note at the end of the day, without having to flip through, some 15 or 20 different pages in the old days when we were doing it on paper. So it's all right there in one note, and it seems to work very, very seamlessly for us.
Oh, great. Yeah, that's exciting to hear, and thank you so much for correcting my memory.
Sure.
I appreciate that. So I think we talked a little bit about how you implemented. I'd love to know your thoughts on our technical support, because I know so many practices have had bad experiences with companies where it's hard to get someone on the phone or get something addressed.
I gotta say it's amazing. I've got email addresses and phone numbers, and I just pick up the phone or send off an email with any kind of issue or concern or a problem that I'm having, and I have an answer practically immediately. Earlier on, there were a few glitches. Maybe I didn't know how to do something, or I forgot how to do something. I'd pick up the phone and I'd have an answer. It's taken care of, and it was done. Your support is awesome.
Oh, that's great. That means everything. In the sales process, you hope that you're doing the right thing by your client, and to hear that they're taking such good care of you after this sales process, it means so much to me in my position, and I know it means a lot to the people that are logged on listening.
Well,
Emily, would you? Oh, go ahead, Dr. Swank.
I was just going to say, we have such a good relationship with Modernizing Medicine. I don't know if you remember that some of the Modernizing Medicine staff, including Dr. Tim Syed, came out to visit our practice to see how we were using Emma, probably in an effort to actually help Modernizing Medicine with their clients going forward.
Oh, yes, absolutely. I mean, I think you may be our largest plastic surgery practice that's using our product, not to mention the fact that you have so many derms on it. So, making sure that we understand the needs of all practice sizes, including our large clients, is definitely important to us.
Yeah.
So, tell me about practice productivity. How do you think that compares to how things were back in, the paper chart day and dictation?
It has not impacted productivity whatsoever. I'm not going to say it's any better, but it's certainly not worse. You know, there's only so many patients you can see in a day, and even our dermatologist who sees 80 patients in a day, I don't know if he can push that to 90 or 100. But let me put it this way, productivity has not been negatively impacted.
Great. Yeah, I know that that can certainly be a concern for people. I think we touched on your notes, but perhaps if there's anything else you want to add to that, or should we discuss something else?
About the notes themselves,
Yeah.
you know, they're just complete. Like I said, when I was dictating, I'd oftentimes forget something, or you know, um, even which side of the face something was on. But now the notes are complete. They're legible, and and just great. I can't say much more about that. The notes are fantastic.
Awesome. I think that photos are something that you're benefiting from as well. And I think ultimately, at least the ones that you take in Emma end up in the notes. So I think it'd be great to talk more about how you use Emma for some things and Canfield Mirror for others, and really how that works in your practice.
We use the iPad to take photos of almost everything in the office. You can imagine with dermatology and plastic surgery both. I think photo documentation these days is fairly critical. So the ability to take the photo in the examination room and the photo populates right in the note is terrific. The photos are of really very good quality also. Some of our cosmetic patients, we do take photos with uh, a Nikon digital camera just so we can get very high resolution photos, and that's simple too. We take the photo, there's a Wi-Fi card in the camera that uploads it directly to the computer. Then from the computer you simply drag it into the note. It couldn't be simpler.
Oh, cool. That's I didn't realize that you were doing that. So I have recommended that to many different clients over the years using something called an iFi,
Yes.
EYEFI. That's what you're
Yeah.
using?
Uh-huh.
Yeah, that's great. So it allows it to electronically upload the photo to the proper folder on the computer without having to plug it in. I do think that it makes using an SLR camera like your Nikon so much more user-friendly.
Yeah, and like I said, of course the photos are better quality on the SLR, and the process is just so simple. You know, I couldn't ask for anything easier.
Okay, great, perfect. So let's talk about Pocket Emma a little bit. I'd love to know how you're using our device that's meant for your cell phone and whether you use the Android or the iPhone version of it.
I use the iPhone version of Pocket Emma, and it's just a convenience. If I'm on call and I get a phone call, or even if I'm covering for one of my other partners and I get a phone call, I can pull up the patient's entire history, chart notes, everything, no matter where I'm at, whether it's at the gym or whether I'm out to dinner or at, out at a movie. I can pick it up and I have all the information right at my fingertips, including the photos, including any attachments, pathology reports. So it's just an ultimate convenience tool.
Excellent, perfect. Um, and let's see. So meaningful use, right? How many years have you been able to do meaningful use so far?
Uh, Three, we've attested for meaningful use for the third time, and each time every single provider met meaningful use criteria, and we've gotten the government checks.
That's great to hear,
Yeah,
especially with how many providers you have and how busy your practice is. I
yeah,
think you're seeing a much higher volume than many plastic surgeons that I know, and so to be able to do that, that's just incredible.
yeah. Again, I see a lot of volume simply because of the amount of dermatology type things that I do.
Right, right, exactly. Those visits go a little quicker. And now ICD-10, were you worried about that before October 1?
I wasn't worried. It is what it is. It was coming, and we just had to accept that. But Emma has handled it very well. during the transition period before ICD-10 was implemented. Modernizing Medicine had all the ICD-10 codes loaded into the system. They were compared side by side with the ICD-9 codes, and since we've gone to ICD-10, our billing department has not had any issues with it whatsoever.
That's great. Really great to hear. I know we're kind of in the lenient phase of ICD-10, and we have a whole nother level of specificity coming.
Sure.
Later this year. Do you find that it helps to gather that level of information in your note?
I'm not sure what you mean by that.
Well, like, laterality, et cetera. Those sorts of specific pieces of information.
Oh yeah, you click on the diagram in EMMA and it gives you laterality, first digit, second digit, whatever it may be, and the ICD-10 code just populates appropriately.
Great. So now remind me again, Dr. Swank, I know I should know this, but how long ago did you start using EMMA?
I think it was 3 years ago, January.
Okay, great. And so I know I've seen a lot of change in the product and just our offerings in general in the 5 years I've been here, but we'd love to know about the evolution of the product and the changes that you've seen that have made it better and more user-friendly and effective for you in your practice over time.
Well, they continue to update everything in EMMA. You get updates almost weekly, it seems, and with every update, it seems to improve, and I don't know really how you improve upon what you've already had, but new plans are added, just different things like that. And anytime I have an issue where in the plastic surgery module itself there's not an appropriate plan, this goes back to your tech support. I pick up the phone or I tell them, and a plan is created, and within the next release it's out there. So it's really good in that respect.
Yeah, that's impressive to hear, because I know that some people are concerned, with not having control of the template and the ability to add their own plans. They're kind of concerned that may be an issue, but it sounds like that hasn't been the case, and it kind of removes the burden of taking the time to build those templates and things yourself.
Sure.
So I guess the question on everyone's mind is, what do you love the most about EMMA plastic surgery?
Once again, I hated to dictate, so I'm glad I don't have to do that anymore. And other than that, the notes are done at the time of service for the patient. The notes are complete. They're accurate. It's just fantastic. I couldn't ask for anything better.
Great, thank you. So I'm going to open this up to the Q&A. I do see that we have some questions that have already been sent into us while we were having our discussion, but I do want to encourage people that have not yet sent a question to look on the GoToMeeting control panel into the questions section and go ahead and type in your questions for me to relay to Dr. Swank. And certainly those who've already asked questions, feel free to send more in. So Dr. Swank, the first question comes from somebody that I think may have missed the first couple of minutes.
Sure.
They wanted to know what practice management system you're using alongside EMMA.
We're using NextTech.
Okay, great, thank you. And the next question here is, and it actually ties right into it, do you find it difficult having two systems?
No, it would probably be ideal to have a single system, but we've had no issues whatsoever. All our patient data is dumped from NextTech into Modernizing Medicine, so we've had no issues with it.
Okay, great, perfect. And do you have you just have the demographic portion that brings the demographics in from NextTech. We don't also push any charges out to generate the claim, correct?
Correct, that's right.
Okay, great. So do you, and I know that you're the physician, so you probably don't worry about this, but do you know how how they handle the encounter forms and getting the charges into NextTech, if there's a process around that?
Yeah, all our billing is taken directly from the bill that is generated in EMA, and then that's simply entered into NextTech.
Okay, great. And this is a question that I'm curious to know as well. So somebody was curious to know how you believe that MIPS will affect you.
I don't know what that is.
Okay, so MIPS is the new program that's going into effect next January. The government is replacing meaningful use and PQRS
Okay.
and the value-based payment modifier and kind of
Right.
rolling it into one bigger, more streamlined program that's going to incentivize doctors that can prove that they have better outcomes than others and
Mm-hmm.
provide service at a less expensive rate, meaning that they don't
Right.
order more labs than they need to and things of that nature. And then it's going to penalize doctors that have poor outcomes and or practice more expensive medicine.
I don't know if I can comment on how EMA would help or hurt us in that respect. We do all of our PQRS now, and we meet those requirements. How that will be affected with the introduction of MIPS, I don't know that I can honestly answer that question.
Okay, all right, fair enough. And I know we didn't discuss this ahead of time, so that's why I was curious to know what your thoughts were as well.
Sure.
So something that we did discuss before, which someone sent in as a question, is a question about how you personalize your notes.
It's really easy. Well, it takes some work in the beginning. All the plans and findings come preloaded into EMA, and you just have to change some wording on how you want it to read or how you want it to say. And then everything stays sticky in the system itself, so you're not retyping it every single time. So it's a little bit of work in the beginning, but overall, really, really simple, very easy to do. Everything's customizable.
Okay, great. So, and I have a couple of questions as a follow-up to people learning what PM you're using, and certainly, you only have to answer the questions you're comfortable with. But one person asks, can you tell us why you use NextTech? And the next person asks, will you adopt ModMed PM when it's available?
We've been with NextTech, the practice is some 20 years old, and we've been with NextTech forever now. So we have you couldn't imagine the size of our patient database with some 30 physicians or 30 providers and 7 different locations. So we've just stuck with it at this point. Would we consider changing over? It depends on what Modernizing Medicine's practice management system looked like. We would evaluate it, and like I said earlier, I think it would be ideal to have a single system for both practice management and the EHR, but it would be something that we would seriously consider.
Great, thanks, Dr. Swank. And just to kind of follow that on this end, I want to share that we have not opened up and started marketing and sharing with our user base as a whole that we have ModMed PM, really in alpha and soon to be beta phases. We have been afraid to start that marketing because we know a flood of requests is going to come in, and we want sales to kind of slowly but surely phase it in. But with the AAD meeting, which is the American Academy of Dermatology, starting next week, I'm sure that the floodgates are going to open, and we'll be sure to reach out to your administrator and get her on one of the weekly webinars that we're doing so that you can start that evaluation.
Yeah, we would love that.
Great, perfect. So we have another question. Somebody wants to know if you download notes and save them nightly.
Download them and save them. They're saved in the system automatically. I don't print them out or anything. They're available, 24/7 on my iPhone or on my iPad or on my home desktop. So I'm not sure I completely understand that question.
Yeah, and I love your response, right? Because that just speaks to your certainty that Emma's going to be there when you depend on it. I think a
Yeah.
lot of practices that either have used a client server EMR historically or have paper, they're afraid of going to the cloud. And
Hmm.
so, perhaps you can elaborate a little bit further about your experience over the last 3 years with Emma's reliability.
We haven't had a problem. I've not had a problem. It's always available. The updates are, terrific. Notes are always available.
Yeah, great. We just had our national sales meeting where we always get really great updates. We had actually for the second year in a row, it's almost uncanny. It's basically the same number, 5 minutes and 26 seconds all year long in 2015 of unplanned downtime.
Hmm.
So that is, really, really reliable. It's 99.999% uptime, which
Yeah,
is something that we're very proud of.
that's terrific. Yeah, we've never had an issue.
Excellent. So the next question is, um, do you pay extra for the personalization of your Emma templates? And is dictation a possibility? I'm sorry, is the dictation extra, or do you just use the iPad dictation function? So I guess there's two separate questions there.
Um, no, we don't pay anything extra for customization, and the dictation we do use on the iPad, and it works very well. It works, I guess, through Siri on the iPad. Yeah, sometimes Siri has glitches. Siri is certainly not perfect, but the dictation works very well. I don't do any dictation on the desktop, but I do use a text expansion program like a macro, where oftentimes I'll, type in 3 letters, an entire, note or an entire paragraph or 2 paragraphs will populate by itself. So that's another thing that I use instead of dictation.
Yeah, absolutely. And I'm going to go ahead and send a chat to everybody here. I'm going to respond to that question to all with a link to that TextExpander software that you just taught me about in preparation for this. So I just responded to everyone with a link to that. I had never heard of anybody using it before, but it's only $45. And Dr. Swank gave me a demo of how he's using it to really quickly and easily customize things, for patients on the fly, and it looked like a great tool. So in case anyone's interested, I just responded to all with a link to that site.
Yeah, it's a great little program because it syncs through both Mac and PC, and it syncs through Dropbox. So no matter where you're working, whether it's at home or in the office, all your little snippets, they call it, will travel with you.
Cool. That's great to know. It's certainly important since Emma's also in the cloud.
Yeah.
Another question is, how frequently does the system crash?
Again, I can't recall the last time I saw it crash. It's so reliable. I think the rate limiting step is going to be your own office internet connection and Wi-Fi. It's nothing on Modernizing Medicine's end.
Perfect. Thank you. And I certainly know you have 7 locations, and I know you're primarily in the Charlotte area, but do you have any practice locations that are slightly more rural?
No, we're all probably everything's within an hour of Charlotte.
Yeah,
It's not somewhat, maybe I wouldn't say rural, but suburban.
certainly suburban. Yeah. Okay, great. Um, so let's see. Do you believe that you need a lot of computer experience to understand Emma?
No, it's very intuitive. If you can use an iPad or any program that you have to use on a computer, you can use Emma very easily. Um, we've had a few medical assistants who have had trouble just because they're, maybe a little bit older, not really computer savvy, uh, um, and it took them longer to catch on. let me put it that way. But no major issues whatsoever.
Okay, great. Um, do you know how Emma differs from template-based systems, and how would you describe those differences?
Probably a question I can't answer very well. The other template system that we otherwise considered was the NextTech system, and when we demoed it, and this was a few years ago, I'll admit, it just didn't seem to have the same functionality.
Okay, great. Um, the next question is, can two different medical assistants or you and a medical assistant be entering data on the same patient at the same time using different devices?
You might be able to answer that question better than I can. I think you can, but we really don't run into that scenario very often.
Okay. Yeah, I'm happy to. That is one of the big benefits of being on a true cloud system versus, something that has a VPN connection or is client server. There is really no limit to the number of people that can be on the same patient chart, same visit. You just can't be doing the exact same thing at the same time, but logically you would never do that, just like you said. So you could potentially have one person having them sign a consent on one iPad, one person taking photos of them with another iPad, and another person reviewing medical history all at the same time. You can really do different things in any order and have an unlimited number of people working on it. So that does seem to be a benefit that some practices really like.
I guess the situation where I would run into that is in our ambulatory surgery center. If the nurse is documenting in the recovery room part of
Mhm.
the note, and I have to tweak the operative note or look at it for whatever reason, yes, I guess I do have some experience with that. Is it can be done.
Okay, perfect. That is a good scenario. So do you find that there is a delay in pulling up previous visit notes, either on the iPad or the computer? And do you find that you need to print them out prior to seeing a patient?
No, the notes pop up right away, and they're really very easy. And there's also little workarounds. You can use the Emma app on the iPad. You can also open Pocket Emma on the iPad, and you can also open Safari on the iPad and log into your specific URL. So you can pull things up on one iPad, 3 different times, and look at things, very quickly. And even if you're only using one platform, like the Emma app itself, the notes pop up real fast, seamlessly.
Perfect. Okay, great to hear. And this, I'm not sure if you can answer this, Dr. Swank, but it came in, so I certainly want to pose it to you, and then I'm happy to take it if you want me to.
Sure.
But this person would like to know if Emma is based on the Amazon Web Services or on the RAC server or some other server.
That I don't know. Yeah.
Okay, I figured you wouldn't. So Emma is based on Amazon Web Services, and we have everything replicated in triplicate. So to explain that, we have one data center in Virginia that does the primary hosting. And within that data center, we have multiple servers that are mirroring what's being done on the primary server. Then in addition to that, the mirroring that's going on within that particular data center, we have two duplicate data centers in addition to that, one in California and one in Oregon, that are mirroring what's going on in that primary location in Virginia. And the reason that we do that is because if one of our engineers, by the way, who monitors, we have a team, security engineers that monitor it 24 hours a day, 7 days a week. If they see on one of their big screens that something is slowing down, it'll turn orange. If it's down altogether, it'll turn red. They can instantly flip a switch, and the practice won't even notice. Dr. Swank never feels this. You'll switch over, and suddenly you're going to be hosted from California, for example. But there's no loss of data, there's no loss in what's going on, and we're still able then to mirror in that other location in Oregon while we repair the primary location. So we've put in so much redundancy and that's why we're able to be so reliable so that Dr. Swank just doesn't worry about it. It was there when you need it to be. Next question. Do you find it easier to complete a note on a PC versus an iPad?
I prefer using the PC, but my staff prefers using the iPad. And the notes are 99% complete after I leave the examination room. So all I do is go back to my desktop. I look if there were any errors or mistakes in the note, or if there's anything specific that I want to say about a particular patient. I might type that in right on my computer and then finalize it. So I do like the desktop version better, only because I use it more frequently.
Okay, perfect. I think we kind of went over some of this, but it looks like somebody has another question about that. Mm-hmm. What parameters did you have in place to base your decision on choosing EMA versus another EMR?
Primarily the mixed practice that we were dermatology, Mohs, and plastic surgery, and none of the other systems that we evaluated could accommodate the two, if you want to call it three different specialties of dermatology, Mohs, and plastics.
Okay, perfect. Great. Well, it looks like, we just got another question here. Somebody would like to know if EMA is compatible with iPad apps such as DocuSign, or does it need a scanner if one wished to scan in documents? And I think, to elaborate on what they're asking, I think they're basically asking on how you handle your consent documentation.
Yeah, well, we have all of the American Society of Plastic Surgeons consents uploaded into EMA, so they're complete in there, and you just scroll to the bottom and sign it. Okay,
great.
The consent forms are all customizable. Also, you can put almost any document into there. Now, another thing we didn't even touch on is the fax capability of EMA. Once I complete a note, I just hit a couple of buttons, and it sends off a fax to the referring provider of what we did and how the patient was taken care of.
Oh, great. And I know, at least in the sales process, we're often asked questions about, whether that's a really lengthy referral letter that's basically the same length as the note, or if it's something that, seems like a referral letter. So would you describe how that's working for you?
Yeah, you can do either. You can just make a quick little note in the fax template, or and you can attach the entire visit note, and you can attach photos also. That's somewhat customizable. You can do either one that you want. Most of the time, I'll send the entire note, which includes the body diagrams and the photos that are in it.
Okay, great. So the person that talked about DocuSign and scanning in documents clarified a little bit. They said that they'd like to know, if a patient gives you their handwritten documents, is it possible to scan it in, and how do you handle that?
Yes, it can definitely be scanned in, or you can take a photograph right from the iPad. Sometimes we get patients with long lists of medications, and before the girls will enter the list of medications, they'll snap a photograph of that medication list, and maybe get back to it, after the patient's left or something like that. So yeah, you can both scan something in, and you can take a photo right from the iPad.
Okay, perfect. That's helpful. I know a lot of people do like snapping those quick photos with the iPads of documents in addition to the photos. So I don't think you're alone in doing that in addition to scanning things in. Mm-hmm. All right. Well, it looks like we've thoroughly answered all of the questions that we have, and I know it's getting late on the East Coast. So I just want to thank you so much, Dr. Swank, for taking the time to talk about how EMA is working for you. And I don't know if you have any last or final words to share.
No, other than I'm very happy with the system, and I think our entire practice is happy with the system. And I would invite anybody to reach out to me personally, for any questions. I'd be happy to answer those questions myself too.
Oh, that's so kind of you. Thank you so much.
Sure.
All right, well, I wish everyone a good evening, and I know that your regional sales manager hopes to hear from you soon. We hope that this has been helpful as you seriously consider adopting modernizing medicines and plastic surgery. Take care and have a good evening.
Good night.